What is a cataract? Cataract is one of the commonest problems which occurs, and it's one of the commonest procedures done for any part of the body. Cataract is where the lens becomes a bit opaque, normally seen due to aging, but occasionally can be seen due to some drugs like steroids or an injury. What happens? The lens should be clear, but as we get older, 60 plus, 70 plus, 80 plus, the lens becomes opaque. So the light rays going into the eye gets blocked, which means the patients usually become aware of blurring of vision for distance or reading, or one of the initial symptoms could be finding it difficult to drive at night because of the glare and halos around the light. Normally we would advise you to see the optician regularly after the age of 40, and then optometrist will usually, optician or the optometrist will usually pick up that you have a cataract. And if you have symptoms which usually are blurring of vision for distance or reading, or difficulty watching television or reading teletext on the television, that's usually due to cataract. There are many causes which can cause blurring of vision, but cataract is one of the commonest causes. So if you see, this is a normal clear lens. As we get older, this is an advanced cataract where it blocks off the light completely. If the cataract interferes with your vision and your life, then that is the time to seek attention from through the optometrist or your GP. Be referred to either on the NHS, or if you have private insurance or you want to be seen privately, you can be referred privately as well. The cataract surgery involves taking off the cataract but leaving behind what is called a capsule, as you can see, and then placing an implant in there. There are indications for cataract surgery, and we'll usually do one eye at a time and then consider for the second eye if it is indicated. Normally you would come for a workup visit, and the workup visit will involve a lot of tests including your vision, your eye pressure, your eye history, your general health history, and then various tests to see whether any other problems with the eye like macular degeneration, glaucoma, and also special tests to assess the power of the implant, and also to discuss various implant options. On the day of surgery, you'll be expected to be in the hospital for a couple of hours as a day patient, normally done under a local anesthetic, either with drops or with a small injection. Majority of the patients opt for having the surgery with drops. The surgery takes between 10 and 15 minutes, and after the surgery we would like you to take things relatively quiet and stay at home, if possible, for the first 1 week. And you can normally start driving in about a week's time if you are able to read the number plate at 20 meters. Under the NHS, you will only get what is called a monofocal implant, which means you get good correction for vision for distance. But if you are going private, you have implant choices which could involve correcting not only the distance but the astigmatism and intermediate and near vision all in one lens called the premier lens or the multifocal lens. Again, you need to discuss that with your optometrist at the point of referral or when you're being examined by the eye surgeon. There are special tests done to see whether you're suitable for those premier implants. And as far as post-surgery is concerned, normally the recovery time is between 1 and 2 weeks. And very, very rarely do things go wrong with cataract surgery. As with every surgery, there are risks. We do one eye at a time exactly for that reason, and the gap between first and second eye depends on whether you're under the NHS or you have it done privately. If you're having it done under the NHS, you will need to see your optician after the first eye surgery, a month or so after the surgery, and if your second eye fulfills the NHS criteria, then the optometrist or optician will refer you for the second eye operation. If you're having it done privately, you have the choice of implant options, and the second eye can be done between 1 and 2 weeks after the first eye if there is a cataract in the second eye and if it is interfering with the vision. Again, there are newer ways of doing the cataract surgery using the laser. It adds value, a bit more predictable cuts of the lens, but again, surgery can be done manually as it's being done now, or if you are going privately, laser also can be used for part of the cataract surgery.
Vista has helped me to become more independent and confident. Vista has also helped me to realise that I'm not the only blind person out there, and there is others who are just like me too. I have also made many friends at Vista, and thanks to them I wouldn't be the person who I am. Vista has also put on a range of activities such as archery, rock climbing, tobogganing, and many, many more. I've also been able to believe that I can do anything that I would like to do. Vista has helped me to realise that I am not just the only blind person out there. I am now a peer mentor, which means I will be able to encourage all the new young children to join in with the activities. Vista would be very grateful if you could donate as much as you like or as little as you like to support them in these very hard times.